Peter. Alright, I'm just going to do it with this one. You guys just get to watch it, alright? Laugh at me. Paramedic Care 2. Discussion question number 2. We're going to be looking at the real life situation of a 21-year-old female who's having an asthma attack, and we're going to answer a couple of questions. So the first one is why would early and aggressive intubation be indicated with this patient? The main reason why intubation was needed in this patient was because the BVM was unsuccessful. They were not able to adequately ventilate their patient with the BVM. And as we look at her situation with the obvious signs of respiratory distress, the fact that you hear the wheezing from the door, we know that she has bronchial constriction because of that. We see that she's exhausted. She has a difficult time even sitting up, which shows us just how long she's been using the muscles in her chest and in her stomach to try to maintain an adequate amount of ventilation to her body. And so we know that she's struggling. As we see her respiratory rate, we see that it's quick and that it's shallow, and the fact that we don't hear that we have a silent chest sound whenever we auscultate the lungs is very very bad sign. And so the fact that she was in the respiratory distress that she was, and that previous means to ventilate were unsuccessful, intubation was necessary, and it needed to be done quickly because she was at a point where she was probably about to fall into either respiratory arrest or cardiac arrest because she was continuing to fall. The next question is, how can you confirm tube placement in this patient? We would do it by auscultating the lungs left and right, and then to listen for breath sounds as it's ventilated, and then also we would listen to the upper gastric area to listen for gurgling to make sure it wasn't set in the esophagus. That's how we would confirm the placement of the tube in this patient. And then what are some of the dangers in intubating this patient? Some of the dangers would be possible nosebleeds that we could cause from doing it nasal tracheal intubation, and then also there's different swelling in the sinus that can occur when you're using that. You've got to use a different size tube, so you've got to make sure that you're doing it correctly. Also, we want to make sure that we don't stimulate the vagus nerve. If she's starting to fall and go into decompensation, I'm hoping that's the right word I want to think of, decompensation. Anyways, if her stats are starting to fall, if she's becoming hypotensive, bradycardic because her body's not able to keep up and starting to fail, if we stimulate the vagus nerve, we might actually drop her down even lower. So we need to make sure that as we're intubating her, that we're keeping a close eye on her stats and doing whatever is necessary to make sure that those stats maintain appropriate levels. And those are really kind of some of the dangers that we would have with this patient.